So, hello friends. Today I'm happy to introduce to you one of our patients who's come in from Australia. I will not disclose the name of the patient, but he came to us for an inflatable penile implant. So the topic today is not uh, what kind of a surgery he went, or what kind of the details of the surgical technique. But topic to discuss with our friend today is that two reasons. One, the reason why he chose India as a destination to get his surgery, and second is why did he choose a penile implant. Hi.
Hi.
So welcome to India,
Yeah.
and today we are talking to you after your surgery has been done.
Yes.
And I think you are doing well.
I'm doing extremely well.
So your surgery has gone well, and now you are traveling back.
Absolutely.
But I need to understand, a lot of patients from the West have a concern before traveling to India regarding the quality of surgery or the quality of the care that they would receive. What were yours? What were your experiences?
My experiences in coming from someone that have been in hospitals actually in multiple different countries, because I work in healthcare myself, was that here in India I got excellent care. And one of the main reasons that you go to another place, especially if it's going to be for surgery, is for the expertise in that particular surgeon. I knew from my experience of watching you on YouTube that you had a high level of expertise, that you really cared about your patients, that I knew exactly what you were thinking. You explained things step by step, and that gave me a level of comfort that I knew that I was going to get some excellent care. So ultimately, I came to India for you because I knew that you were going to give me a very good experience.
I need to understand a little bit more about the reason that you decided to go for an implant surgery. Like you were already using injections
Yes.
before,
Yeah.
and you were happy with the injections, but at some point you decided, that no, I need to, get rid of these and get my sex life back in control. So if you could just take our viewers through the decision-making process.
So I dealt with erectile dysfunction for about 10 years. At first I was on pills, sildenafil and things like that, and vacuum pumps. And those seemed to help for a small amount of time, but ultimately, those didn't become options that were viable for me anymore. Physicians back where I'm from put me on injections, which that was a very hard step to take because those injections can be slightly painful. They have to be refrigerated in most cases, and they make you very tied to a medication, and it removes a bit of intimacy. So myself and my fiance, we would have to plan, and that would take away the spontaneity, and we knew we wanted to go on vacations, and even when we would go on vacations, we'd have to have a refrigerator bottle to preserve the injection type medications. And ultimately, one of the things that I had been reading was that injections over time can lead to fibrosis, problems with the penis, that I really wanted to avoid. So after being on injections for about 2 or 3 years and having to have increased dosages with those, ultimately I really felt that a permanent answer like an implant would be a good choice, because that would probably return some form of spontaneity, in terms of our intimacy.
Okay, so that's great. So you traveled to India for a surgery. So you are a hiker and a blogger yourself.
Yes.
So for other people looking at traveling to India, would you share some tips? How to plan or how to find the facility, or how did you plan your entire journey to come here?
So I began just by looking at where the clinic was on Google Maps. I could see, hey, that this clinic is right here in the heart of Delhi, that there are many beautiful hotels around, there's a lot of sites. I think India is underestimated by a lot of travelers about how easy it is to get here, how easy it is to get around. I personally flew and had one layover in Dubai, spent some time there, which was beautiful, and I was able to integrate that into my trip, and then came straight from there to New Delhi. Once I landed, it was very easy to get to my hotel. What's wonderful is that you guys helped set up all that stuff, made it very easy for me. You gave me a representative, Tenzing, that was fantastic and told me all the things that were around and gave me an exact amount of time about how long I should be here, what my first appointment with my lab workups would be, and that helped me plan out my entire trip, because when I got here I was able to say, came in for my pre-labs on one day, and then the next day I went to the Taj Mahal and spent the whole day sightseeing. And then came back and was able to do a couple things around New Delhi, the Lodi Gardens, things like that, because there's so much to see here.
Okay.
And then ultimately went back to my hotel and we planned out when my hospitalization would be. You guys told me when I would be discharged well in advance, and we followed that plan, and then I was able to go back to my hotel and be very comfortable.
Okay. So when we interview men who are going back with surgery, we would also, want some critiques on, how to, what we could do better to meet expectations, or what are the things that, you would look forward to if we could provide them, for other travelers they could benefit.
I think the hardest thing about whenever you have surgery or whenever you are in a place that is new to you is communication and the ease of communication. Ultimately, I think communicating with me about exactly what time to be here or how long I'll have to wait, or that would probably be the only thing, because ultimately I had a fantastic experience overall, and I felt that having someone I could easily reach out to on WhatsApp was great. But that's otherwise, no, it was great. Everything, even down to the hospital food, was fantastic.
Thank you so much.
Yeah.
And the last question is, you chose an inflatable implant for yourself. Mm-hmm. At any point during your research journey, did you consider a malleable implant?
I did consider it. I think for me particularly, I live in a very hot region, so I wear shorts a lot. So having the extra bit of the ability to kind of disguise maybe that I have an implant by being able to deflate the device, to me that was probably the deciding factor as to why I went with an inflatable device, just for a bit more of a natural feel to it.
Okay, so I think that's it. Thank you so much. I'm sure our viewers will find a lot of points of interest. The one message that I want to give my viewers is that before you make your decision to choose an implant, countries really don't matter. There are doctors and facilities across the world now which are doing great work, and you should reach out to them, and then you should consider India especially as a destination for your surgeries or for your medical treatment. Thank you so much, Mr. A, and have a safe journey back home.
Thank you very much.
Thank you.